So the problem with conventional dentures, they come in two categories, and the categories are stability and retention. The movement of the teeth during function. So if they're trying to eat, say like corn on the cob, they're trying to incise into food, typically the dentures will lift in the back. Basically, they're riding on the alveolar ridge or what's left of the ridge. And over time, people can lose that bone. That bone will dissipate over time. And somebody that's had a set of dentures made in their early 20s and now they're in their 60s or 70s, those dentures are not as stable as they were all those years before. The other issue is the retention of the dentures, or the ability for the dentures to actually stay in the mouth. So if somebody, say for example, yawns or laughs real hard, sometimes a conventional denture can drop or move or actually come out of the mouth. And so, depending on the social circumstances, that can be really, really bad for somebody. So a lot of times for the retention of the dentures, people like to use denture adhesives to help glue the dentures to the gingiva. And that only has a certain lifespan, like maybe an hour, 2 hours before they have to keep reapplying it. So it gets kind of expensive to keep purchasing denture adhesives to use over and over and over again. So the nice thing about implant retained dentures is it secures the dentures in the mouth. And there's different ways we can do that. We can do it where the dentures are actually screwed to the implants themselves, which makes it more like a fixed bridge. Now those teeth do not come in and out of the mouth. We can take them out if we're going to clean them or if we have to repair something, but it requires special instruments to be able to remove that. That's not something that the patient is taking in and out of their mouth at home to clean. Other options could be that we do a removable type denture that either snaps onto implant abutments or onto a bar that we fabricated for the dentures to clip onto. In that scenario, the patients can remove those teeth and clean them at home and then put them back in. The nice thing about dental implants is once they're placed into the bone, it kind of tricks the body into thinking that they're actually teeth. And so the natural resorption of the alveolar bone is stopped. So if somebody gets all their teeth out, over the course of time, that remaining bone will slowly wear away, which has a tendency to make the dentures more unstable over time. Once we place the dental implants in the bone loss stops. It will not proceed beyond the level of the implant. So if you're just in conventional dentures that are essentially floating on the gum tissue, held in place with denture adhesive, you're only able to generate enough biting force to maybe do like a mashed potatoes and meatloaf kind of consistency of food. Once we attach those teeth to dental implants, they're as strong as your natural teeth, and you're able to bite into steak, potatoes, whatever your favorite food is. So the diet changes once you have the teeth secured by the dental implants. You're no longer eating soft foods, you're transitioning more to a normal diet. That's probably the biggest driving factor that we see with patients coming in for treatment plans and consultations and care, is that they want to improve the quality of their life. They want to be able to go out and do their thing without having to worry about these dentures all the time. And it's really a significant life-changing decision that they make. And I've never had a patient come back and say, wow, I really regret having gotten rid of my dentures. Every single patient has been so happy that they've gotten rid of their dentures and they're into something now that's more stable. So it's really just been an incredible service to offer for patients that have lost their teeth over the years.